Good to go. All right. I'm gonna go ahead and call this meeting to order. I have 9 a.m. So this is our regularly scheduled meeting for October. I know the weekend may have not been so great with the game, but the weather was certainly beautiful. And we're gonna open this meeting up with a prayer. I'm gonna ask if Supervisor Trainer, if he would open us up with a prayer.
Let us pray. Our Father in heaven, we come first of all to say thank you. We thank you, O Father, for the opportunity to be here on the first Monday in October. We thank you, O Lord, for things as well as they are. We thank you, Father, for the ups, and we thank you for the downs. And we just ask and pray, O Father, you just keep us together and keep our mind focused on the things that we need to be focused on, and give us good insight, O Lord, that we may consider and discuss and make decisions on these things that are pleasing in your sight. And Father, we ask special prayer upon anybody that's been impacted or affected by this pandemic and other things that's going on across this country and across this world. And Father, we pray that once our business is done, that you give us traveling grace to go our separate ways, find things in order where we may go. In Jesus' name we pray. Let's all say together, amen.
Amen. Amen. Thank you, Supervisor Trainer. Thank you. All right, moving right along to the approval of the September 2020 board orders. Need a motion and a second.
So moved.
Motion by Supervisor Trainer. Second by Supervisor Miller. Any more discussion on the minutes? If not,
Do we need to do the thing about the bond money separately? Is that one? We need to do the one with the bond money separately?
I think so. I think so with the other ones.
Number one.
all right, what,
Number one, I believe should be 3-1 with, 3-1 wasn't 4 people present.
I got
Instead
you.
of 4-1, should be 3-1.
on section 1 of
Section
the
1.
September 3rd meeting.
Third meeting. And, I believe Mr. Baggett wanted to repair not a low boy, a road grader.
Where are you
Repair
at?
road grader, that's on number 10 on the same meeting. Will you repair a low bar or repair a road grader? Permission to repair a road grader.
The road grader, that was,
For an auction.
well, I want the last minute, wasn't it?
Yeah, that was the minutes for,
As the minutes
September
read,
3rd.
yeah, as the minutes read, it says the purchase of 6 tractors, 3 side cutters, 3 bush hogs, and 4 18-wheelers, 1 lowboy, and to explore what is necessary to repair the existing lowboy. And then it was motion second and approved.
I thought we decided that,
I
that was
thought-
for an auction.
I thought you wanted to repair the road grader.
Yeah, I thought we talked about, putting that grader on the auction list.
He had one on auction, but has some more permission to repair. So, but maybe that's right, to repair a low boy.
I didn't, I'm sorry, I didn't break the grader.
Okay.
We talked about the grader, but I didn't say anything about the repair.
Okay. The grader I think we were talking about in question was the one that is the one that would do the side ditches, the ditching to the side.
And it went in the auction,
That's when you go to the auction.
it went to the auction.
But you had some additional ones that you thought could be repaired.
Yeah.
And didn't you need permission to repair those as needed?
Well, actually, since then, Mr. Williams, we looked at that grader again and decided we're gonna use it, just make a long story short, no,
Okay, thank you.
All right. Anything else?
So approve the gift, and then
That was not,
You good? Okay. All right. Any more discussion on the matter? If not, all those in favor, say aye. Aye. Motion carries. Talking about the minutes, so motion carries unanimous. All right. All right, moving right along to the citizens' comment period, where any citizen can come before the board for up to 3 minutes and address the board. Seeing there are none, we'll move right along. Year-end report, Mr. Morgan.
Good morning. Good morning.
Good morning.
Good morning.
First of all, we asking the board for approval on the surrender tax list.
So moved.
Heard the request, motion by Supervisor Trainer, second by Supervisor Williams. Any more discussion on the matter? All those in favor say aye.
Aye.
Motion carries unanimous.
Mr. Governor, I didn't need to
Yes,
sign
sir.
that.
Black ink okay?
Also, I'm asking the board for approval on the bad check list.
You've heard the request.
So moved.
Motion by Supervisor Trainer, second by Supervisor Howard. Any more discussion? If not, all those in favor say aye.
Aye.
Motion carries unanimous.
Mr. Governor, I need you to sign that.
Sure. I'll do that in blue. Thank you, Ms. Sherry.
Also asking the board for approval on the uncollected business personal property list.
You heard the request?
So move.
Motion by Supervisor Howard, second by Supervisor Miller over there. Any more discussion? If not, all those in favor say aye.
Aye.
Motion carries.
Need you to sign this. I see what's coming.
Howard and Miller.
Asking for board approval on the uncollected mobile home list.
Motion by Supervisor Williams, second by Supervisor Trainer. Any more discussion? Not all those in favor say aye.
Aye.
Motion carries.
Need you to sign this also, Mr. Governor. We also got a homestead exemption deletion. I'm asking for board approval on this homestead deletion.
So move.
Motion by Supervisor Howard, second by Supervisor Williams. Any more discussion on the matter? If not, all those in favor say aye.
Aye.
I need the board clerk, Ms. Livingston, to sign that.
Yep.
Also asking for board approval, we got some personal property assessment changes.
Heard the request. Motion by Supervisor Williams, second by Supervisor Trainer. Any more discussion on the matter? If not, all those in favor say aye.
Aye.
Motion carries unanimous.
Mr. Governor, if you sign all three of them.
Okay. You need to sign these two, Sherry? Sorry. So much. You got a full quiver this morning, don't you?
I do. Got one more. I would like the board to advertise for a mapping contract, the maintenance. Mapping bid, last time we did it 2 years, I would ask the board if they'd consider doing 3 years this time.
Motion for approval.
All right, motion by Supervisor, Williams, second by Supervisor Howard, and for 3 years.
3 years, yes.
Okay.
That's what-
Any more discussion on the matter? If not, all those say aye.
Aye.
Motion carries.
I think that's all I have unless I missed out.
Did we only get one person last time to agree to do the mapping? For the last few, that's for the last few years, so.
About this increase.
I guess I just wondering how could we advertise and get more individuals interested?
Well, it was advertised in the paper, so. You know, many people.
Just their personal
could
property
be in.
changes.
Is that locally or
The
several
place that
different?
got it is, they got an office in Philadelphia, they got an office in Alabama, they got one, I think in Georgia too.
I can put it in more than one category. No, that's right.
Yeah, let's put it in more than one paper, because we haven't been getting one company to accept a bid for that.
But they have kept their prices pretty much the same, they've been doing it here for over 30 years, 30 years.
I believe it went up last year, though, but anyway, that's good.
That's all I have.
We certainly appreciate you. Thank you, Mr. Morgan.
Yes, sir.
All right. Moving right along to the Art Council, Mr. Bateman. Good morning.
Good morning, thank you all. John Bateman with the Starkville Area Arts Council, and I'd like to thank the county for their support of the Arts Council. You guys are one of you're our third largest funder, not counting in-kind gifts, behind the Mississippi Arts Commission and the Starkville this Greater Starkville Development Partnership. And so I'd like to come up here before you guys at least once a year, but I'm always available if you want to learn more about what we're doing. So I'm going to try to just focus on some highlights for the past year. This is not everything we've done, but I did want to give the county a recap because you are one of our largest funders. Our fiscal year ends June 30th, and we did stay in the black. We had net revenue of $1,800. We're probably one of the few arts organizations or nonprofits actually in the state that stayed in the black this year. And so we're very pleased with that, but we're not out of the woods. I don't think any of us really are, and this year's going to be critical to stay streamlined and do some effective fundraising. And some of the highlights from last year include our art education and outreach programs, which that includes Art in the Park, which many of you know about, after school initiative Art Partners, where we pair up with other nonprofits to provide them with a teacher and supplies for after school programs. We expanded that into literary arts this year and really working to strengthen those relationships. And then when COVID hit earlier this year, our grant pool had closed, but we reopened it to take part in something we called Stay at Home Fest. It was a collaborative effort with locally with the Del Rendon Foundation, who focuses on music, but also with a statewide effort to provide micro grants to artists. And so we distributed more than $4,000 in micro grants to more than 40 artists locally as a way to try to provide some relief to what's been happening. Most of them have all lost income and revenue, and that's what the focus was. This year, with our art education and outreach, the challenge has been how do we provide outreach when we can't meet in large groups? And so with Art in the Park, we switched gears and distributed art boxes, which is something we did last year for our after-school program. This year we did that at Jail King Park on a Saturday, and we also explored going into the county, and so we distributed, this past Saturday we went to Maven and distributed some as well. And that was a date that we shared with Octavia County Hospital, the NAACP, Reading to Succeed, which is part of the school district, and the census and Ushers Ministry, as a way for all of us to share the same crowd. We all have our separate mission, but we wanted to share this date since it provides a lot of different organizations to do their own outreach and sort of take advantage of a drive-through mechanism. With Art Partners, we provide teaching artists and supplies to 4 locations. It's the Jail King Center, Pecan Acres, Youth Explosion, which it's actually changed its name. It's now called PrEP. It's a Christian World Mission, as well as Summit Extended Day. Only 2 of those programs are operating right now. One is meeting in person, and the other one is still in touch with their youth. And so we're distributing art boxes to them to make sure we can get supplies to the youth. And we're exploring how to provide lessons to the students in the facilities right now. With our arts festival and some other economic development type activities are organized under a program area we call the Creative Economy. Those micro grants that we gave away, we're continuing to do those and looking at how we can be more strategic with those, as well as doing some public art efforts to create a sense of community and to highlight the visibility of the city and its art resources. And this year, fundraising is going to be a big focus. We did hire a fundraising coach. We actually have shared that coach with other 501c3 organized nonprofits here in Starkville. We've invited them to attend. We look at that as an investment in the community, because if we all do well, then we sink or swim together, and that's really the philosophy we have, is that there's enough resources for all of us. And when you look at the county as a whole, roughly 35,000 folks live above poverty in Oktibbeha County. The median income in Oktibbeha County is roughly $37,000. The average giving that a household gives is 3%. So if those 35,000 people give 3% of their average to Oktibbeha County, that is almost $39 million in 1 year. And so when you lay those numbers out, you realize that that's a lot of impact. And so what we hope to do is pair up with some other nonprofits and sort of generate this advocacy, public awareness campaign to remind folks that giving a little does add up, and that we can all benefit from that. So that's some of our programmatic focus. We worked really hard to make sure that our programming reflects the community, reaches the community, particularly the community in need. Our board now approximates the county demographics, which we're really happy to have. And I'm here for any questions. So if anybody, supervisors first, obviously. So if anybody has any questions, please let me know. But again, we do really thank you for the funding, and we really appreciate it. And we just want to make sure that this relationship is a good, strong one. And I'm available anytime you guys have questions. So
I don't have a question, but I would just like to comment to you. I attended the event Saturday in Maven, and it was great support, great turnout, and I think everybody thoroughly enjoyed that. So I'd just like to give you and your team kudos for the wonderful job, and I'm hoping that can become an annual event in Maven.
Well, thank you, Mr. Howard, and I have to share that with the hospital and the other organizations that were involved. 4-H also participated in the one in May. I think the hospital, we all planned for about 100 youth, and the hospital ran through their distribution in like 20 minutes. Took us a little bit longer, but thank you. It was a wonderful day.
It was.
And Mr. Bateman, how, if you were going to donate, if an individual out in the public or on our Facebooks would like to be able to donate to this worthy cause, how would they go about doing it?
Go to starkvillearts.net, and we have, if you are looking to donate, we have donation options on under the Donate and Help tab. We also really look for volunteers. I mean, that is a critical. If you can't donate, $5 is great. If you can't donate at all, volunteers are even better, especially with the Arts Festival. If you are an artist who's looking to take advantage of some of these micro grants, go to the same website, go to grants, and that new grant application is now open for the micro grants.
Anything else from you? Yeah, we certainly appreciate what you bring to the community, Mr. Bateman. Thank you for the update, and by all means, we welcome you to our board anytime that you would like to, give us an update on what's going on with the Arts Council. So, thank you for everything that you do. Anything else that you'd like to add, you can, but we certainly appreciate everything you do for the community.
Thank you so much.
Thank you, Mr. Baker. All right, moving right along. Maven Property Trash Bill, Mr. Earl Baker. See, he's not here.
Just for the information purposes, I spoke to Mr. Baker on Friday, and I don't know why they're not here today, but he said he was gonna be here. Is it the board's will for me to help them understand this garbage? Because they may have a issue that is distinguishable from some of our other problems. In other words, they may have gotten this property before they were owed to pay it. In other words, in our policy procedures, that was one of the things that I discussed with them. So is it okay with this board if I discuss that with them, even though this policy hasn't been distributed to the public yet? Thank you.
Yeah. Sir.
You know, as we're talking about this too, I think it's important to, you know, a couple of things in this transition period for us to think about these people that didn't know that they were accumulating these large trash bills. You know, when you have water, power, or something like that, when you quit paying the bill, they cut it off. But, you know, these renters, you know, they had just assumed they were still there and were still spending that bill, but they weren't paying it, so it was accumulating for the landowner. So I think that's something to consider. And then were they actually getting the service? You know, if there wasn't a renter there and there wasn't a trash can at the end of the driveway, was the truck actually stopping? So are we asking them to pay for something that, you know, maybe they weren't actually getting? So I think there's a lot of things to think about as we move forward on this.
With y'all's permission, at some point, I've got a draft that is not ready but it is something that we're going to talk about and come up with some issues, but it's possible that we may need to go into executive session because there could be some legal ramifications to what we're going to be talking about. So if you want to, we can do that at the end today, if that's, I think it's okay. Thank y'all.
All right. Yeah, let's get to the end and then we'll certainly do that and also give Mr. Baker a chance. Maybe he's running a little late. So at this time, we'll move right along with our health insurance proposal. Mr. Hollingsworth, Collier Insurance, Memphis, Tennessee.
Good morning.
Good morning.
Thank you all so much for allowing us to come and introduce ourselves and our capability study in our presentation today. I have with John Collier. John's fourth generation Collier, and we've been in Memphis since 1911. And I don't want to steal your thunder, John. So
Yeah,
take it away.
so I just want to thank supervisors in Ocklawaha County, as well as Emily for all your hard work and what you've done. And honestly, you've got a great person with Emily that has helped us with a lot of your needs and how to meet them. But what we are trying to do is really two things, just to make it simple. We want a better experience for your team members and employees of Ocklawaha County, and we want it measurably better. And we want you to pay the money you should be paying, actually less, because of our direct contracts with hospitals. So we're going to talk about how this works today. I've got a short PowerPoint. Emily had to go through a longer, more painful PowerPoint earlier this week, so trying to shorten this one down. These are the players that we are proposing. Collier as your broker, HPI, which is a financially accurate TPA. Yes, sir. Oh, sorry. And please stop me because I can get on the roll. So anytime you need to ask a question, please stop. HPI, which is a 99.98 actually financially accurate TPA compared to a Blue Cross, United, Cigna, Aetna. That's about 70% financial accurate. We have a combination of the Mississippi Physicians Care Network. Baptist is a direct contract at 160% of Medicare. That also includes Ocklawaha. We'd be paying them 150% for inpatient and about $225 for outpatient for Ocklawaha. KissCard, which is a bunch of direct contracts for ortho, cancer care, which does basically the same thing. Epiphany, which is a pharmacy benefit manager that gives us all our rebates back, manufacturer copay assistance, eliminates spread pricing, and then a concierge service, which averages a 92 net promoter score, which is how likely you are to recommend to a friend or family member. When you look at Blue Cross, their average net promoter score is 16. 16 is not very good. So if we can get it up to 92, that would be fantastic for your employees to actually have a good experience like they would when they go to anything else, like a nice restaurant or a hotel where people take care of them and really care about them. And we will put our compensation at risk based on those two things. Your employees having a better financial experience and also a better experience overall. This is what the card is gonna look like. Keep in mind, we have this Pathways Concierge down here. They call them, they will set doctor's appointments. They will do everything but tie your employee's shoes for them. They will direct them to the best opportunity for care from a cost perspective as well as a quality perspective. A little about our firm. We've been around for about 109 years. We've got about 36,000 lives under direct contracting. That is really our bread and butter. What we do is direct contract with physicians and hospitals. We've become very, very good over the last 9 years. We have about 200 million in annual claims that are processed. We are out of Memphis, Tennessee. I am fourth generation of this company, and we do believe in the two items we talked about before. Our partner to administer claims is Health Plans Incorporated. They're a $9 billion company out of Boston, Massachusetts. They are owned by Harvard, Pilgrim, and Tufts, which are two very large hospitals up in the Northeast. But the reason we like them are these two things. They pay claims quickly, they pay them accurately, and they own the concierge service that we use that averages a 92 Net Promoter. So better experience and more financially accurate. That's what's important to us. I'm not going to play this video, but they do have a video that we send out to team members where we talk to the person at the concierge service and actually communicate to them. I may play a snippet if you don't mind.
So good afternoon, Mike.
So you won't really go for it. If I can't skip forward, I'll see this. But what's great is communication. We're very good at communicating that process and getting people to use this concierge service, which will increase their better experience. And of course, give us that score at the end of the year with a good Net Promoter. Fabulous. I think when we talked to Emily earlier, we first came with a deal with North Mississippi, and she said, actually, most of our people use Baptist. That is probably the hospital most utilized. So we went to Baptist and made a deal. The deal we made is about 160% of Medicare. If you want that equivalent, what that means to you guys is when we look at Blue Cross deals, they're well above 300% of Medicare, probably around 320, 330. So what we did is we just basically went to them. We said, we've got this municipality. They already have a lot of business. We want to secure that business. And maybe what we give to them is a slight differential in co-insurance, maybe 10%, not much at all, for people to use that Baptist facility. So they get a little bit of steerage. We use their physicians with the deal that they have, which is comparable to Blue Cross's. And these inpatient and outpatients, we save a ton of money. We wrap that around Mississippi Physician Network, which is a huge network. There's really not any doctors within the two base areas that you have tons of employees where we're missing anything from an access standpoint from Blue Cross Blue Shield. And if we are missing a physician, the great news is we've got a team of people at Collier that go out and direct contract with those physicians, and we'll do that very easily at a percentage of Medicare that's fair. We have a thing called a bundle network, and quite simply what happens is we get a much better deal than Blue Cross, close to 120% of Medicare, by giving employees an option. You basically say you can use your card and the deductibles and co-insurance and out-of-pocket that goes with that, or you can use this Keep It Simple surgery card for surgery, all these different items that we have listed, and you pay nothing when you go there. Now the reason we do that is there's a pretty good spread between 160 and 120% of Medicare, where we're saving money as an employer. And what is the facility getting? Well, they're getting out of the collections game. Because all along, what people have done to reduce costs is just raise their deductible every year. Keep raising it, keep raising it. And so we take them out of collections, and they give us a deal better than they give anyone else. So this is an option for employees. They, of course, have direct contract with Baptist. They can go to Octavahall. They can go to all the physicians that they normally go. But this is option number 2. And they just call the card and see if it's a better option for them. We are also proposing that y'all join the largest captive in the U.S. for health insurance, Pareto Health. The reason is they're going to throw in things like KISS card, cancer care, which is another form of KISS card for cancer patients. They're gonna give you the FIA group on retainer, which is a law firm. There'll be a co-fiduciary on the plan, so you'll get rid of that fiduciary liability that you've had, as well as they'll answer any legal questions you have during the year. Then you'll get an analytics system on top of that with Spring Money. All of that is provided in a quote that is less than what you pay now for stop loss. It also gives you a cap on renewal from an increase standpoint, as well as a no laser contract, which you all have had several lasers in the last couple of years that have been issued. So, there are 1,000 different members, just like yourself. The average size is a little bit smaller than y'all, but overall, we're using that buying power to get us these items for free, as well as cap our increases every day. From a pharmacy benefit manager standpoint, or network for drugs, you see this purple part, this is what you pay in drugs today. And y'all are collecting some of this money. You have an amount of rebates that you're getting today. But there are 3 other items where you're not collecting money. One is a copay assistance. Those little drug cards that the doctor gives you to say, hey, this is a really expensive drug. Take this little coupon card in there, I'll make it for free. The manufacturers are doing that so you can buy their product. They're manipulating the market. All we're doing is capturing that money. And that means $13,000 in extra savings to you guys. Also eliminating spread, which is just Prime Therapeutics, Blue Cross. They're saying the drug's $1, but it may actually be 50 cents. They're building in some spread each time, right? They usually do it on the generics. So we're eliminating that and we're collecting that money. We're collecting money on clinical. So there's better opportunities. There are actually different drugs people should be on based on their diagnosis. And then you're gonna get your rebates just like you do today, but you're gonna get all of them.
So you get these numbers, the final number, the 56,000 number.
Yep.
Is that just from looking at our policy?
From the claims, that's right.
From our current claims?
Reports,
just
yeah,
from-
and so, I also have numerous case studies that I can send you guys on the same savings with Prime Therapeutic. You know, Prime being so widely used in Mississippi, we do so many of these analysis where I can start to get averages and they're pretty close to the averages.
What about some of the claims that were so costly for our county? You know, they're probably aware of them, things that we're still paying for people that maybe are retired or something like that.
Right. So we had retiree census data and information like that. The data that we had was on a 12-month basis, and then the last 12 months up to August. So that's what we ran off of. And it's always going to be a snapshot, right? You can only reprice the last 12 months of claims. I can't tell you I'm going to save you $180,000 if you have 12 cancers next year. I just tell you you're going to pay less for them, right? That's all we can do. So that does lead us into the financials. I always like to look at industry averages. You know, what the facility, physician, and drugs are from Kaiser, Department of Health Human Services, and American Medical Association. Usually runs 54 for brick and mortar, 19 cents of your dollar goes to RX, and 27 is physician. In 18, this is what your pile looks like. 63, 17, and 20, with more members on there last year, or in 18, 19. And then in 19, 20, this is what it looks like. 66% is going to brick and mortar, 15 cents of your dollar is going to RX, and 19 cents of the dollar is going to physicians. So what we are doing is basically taking this pie and eliminating 17% of that. Now we're doing this in numerous ways. We've got RX savings, that's about 5.3% of the pie. There's another 6.6 putting in our contracts with B.O.S. And what's really interesting about this, trend is a killer in this industry. So I'm gonna show you that in a little bit. But if you think about it, you could be getting the best discount in the world. You could be beating 160% of Medicare. But guess what B.O.S. and Octiva Hall is going to do over time? They're going to increase the amount they charge, and your discount's going to stay the same. And they can do this when they want, right? The beautiful thing about Medicare, trended at 1% over the last 10 years. So if we got a deal at 160% of Medicare, you can tie your trend to 1.6. which is pretty nice. On your largest line item, which was 66% of your spend last year. Then claims accuracy, 3%. This honestly could be a higher number. I'm being extremely conservative. The average we see is 5 to 6. And then 2.5 for bundled network. This is also a number where I'm taking the national average of savings first year. This is what it would look like from a fixed cost perspective. There's a little additional savings because we're saving some on the stop loss as well as our administrative fees. So this is what it looks like currently. This is what it looks like over here. Fixed cost in purple, blue is medical, pharmacy is light blue. Like I said, from a trend standpoint, per member per year in 19, this is what you look like. This is medical, this is drugs. This is medical in 1920, this is drugs. This is where we're proposing to take you guys. But what's more important than the per member per year is what this is gonna look like over time. And what I look at is trend analysis. Time to Medicare, right, at 1%. We've got our direct deal. Then you've got Aon, Milliman, Willis. I look at your trend, it's a heck of a lot more than 6% last year. But if you just take the average trend, because you're gonna have good years and bad years, right? 6%.
Any law changes coming out that, any policy changes that are gonna change things or anything?
No, I don't think there's anything that's gonna really impact the spend. It's just that rising cost. You gotta eliminate that trend. I mean, that's the most important thing, right? That from a compliance standpoint, we have compliance resources. All of that is gonna be in folders we're gonna hand out, as well as our presentation for y'all to review. But this is what's big, right? If you continue to go at 6% or over 6% last year, in the next 6 years, you're gonna be spending $2.3 million. That's without y'all increasing the amount of employees that are on the plan, because that's gonna just compound again this issue that you have. And with the HPI Baptist deal signing at 1.6, HPI's book of business that's not in direct contracts runs at 3%. So I would already cut this even if we didn't have a direct deal. But with the direct deal, that's the type of impact we're putting over time. We're gonna put our compensation at risk based on us exceeding goals. $300 per member per year. If we beat that, we're gonna earn ourselves an extra $1. If we do $500 per member per year, we're gonna earn ourselves an extra $1. And then on an ongoing basis, we're gonna tie our results to trend. And for the net promoter, y'all score a 16 today. They are an average 92, but more than double. We're gonna go 45 and we're gonna put $1 on the line for that. And we're gonna put $1 on the line to increase above 7. So our goals are aligned with you. If your employees are happy, we're happy. We're getting paid more. We do a kicker if we hit all 4 goals. But my thought process is we're gonna earn our way back to where your current broker is, because your current broker is getting paid off stop loss. And so all we are trying to do is earn back maybe even a little less, because your stop loss is at $494,000 and they get 10%. So for us, if we hit everything, 10% of $494,000, that's $49,000. We're gonna go from $34,000 up to $44,616. If we hit everything, if we crush it. So that's really where we're coming from. We want to put our money where our mouth is. A lot of people come to you supervisors with great ideas, but you're like, how can you tell the good from the bad? Well, I'll tell you with us, I expect to earn every dollar of compensation, and I expect everybody here to be very happy to pay us at the end of the year. So that's what we have. I'll open it up for any additional questions.
I do have a question. In other words, explain to me, say someone wants to go to OCH and not in the Baptist network, what would, in other words, let's say I get an asthma inhaler every couple months, whatever. Go to your doctor, local physician here, kind of walk me through. I mean, are they gonna push them towards Baptist, or are we gonna stay with
No, we're keeping our Tibawa County in network. And medical, OCH. So they're still gonna be in there in the Mississippi Physician Network, and you can still go there. We're not penalizing anybody to go there. We may give an additional incentive like 10% better in co-insurance, or maybe $5 better on the copay to go to Babbitt's because they're giving us 160% of Medicare. But we're not gonna penalize anybody to not, to go where they used to go. And the physician network shouldn't be changing at all either. We're just
So,
making it
The way we've always told this to people is, in your mind, you've always been taught a network, some sort of parameter, like a fencing, is what we always talk about in the industry. Well, imagine that network fencing is just now knocked down completely.
Yeah, because here's why. We have a network, we have Mississippi Physician Network, which is owned by the doctors in Mississippi. So it's one of the strongest networks in Mississippi. Almost all the doctors want to be in there because they get a piece of the pie when you join, as well as the hospitals. But if there's anybody outside of there, Mississippi Physician Network doesn't stop us from contracting with physicians outside of it. So we can make phone calls. You give us who that physician is. We call it a blue sheet. Name a physician, employee's name. We go ahead, call that physician, and build them into our network.
Blue Cross Blue Shield doesn't allow you to do that.
With the team that we have. So it's kind of nice because we can basically have no disruption because of we don't have a network that's keeping us within parameters that you're used to. Go ahead. Sorry.
How about if you go out of state, if that people have to go over the UAB?
Yeah, so UAB, that's a great question. Of course, we can use a variety of different networks. There's a company called Zealous that gives us the best of whatever network there is outside of Mississippi Physician. I think that might be our best bet, unless you want to use Alabama Premier Network or something like that, if we have a decent amount of traffic. From the claims that I saw, I didn't see enough traffic over there to recommend an additional PPM of Alabama Premier. I would probably pay those claims with Zealous, but if you do want to add that at some point, that is an option on top of what we have.
What type of computer system is used so that myself or my personnel part is like Blue Cross has, we go in there and pull our claims down and that sort of stuff, you know what I'm talking about.
So you'll have two choices. The captive is going to provide Springbuck analytics, which is not just going to be the Blue Cross claims that you pull down now, but predictive analytics as well.
Okay.
That uploads on a weekly basis. But HBI also bought, I think, even a better system called DeerWalk. And I'm happy to show you exactly what it looks like. You add people to terminations. I'd like our team to do that. You send it to us, we'll just take that off your plate because why would you be doing that? But at the same time, from an information standpoint, you're going to get an upgrade in the type of information you have. You'll have benchmark reportings to where you can look at it nationally and get DeerWalk's book of business as well as HBI's book of business as well as 5 or 6 other standard benchmarks.
Okay, so we will have computer access for our data.
Absolutely, and when we get everything up and going, I'll run you through the demo. I think you'll be very excited with the system.
And a lot of the times we'll connect you with our account managers and we'll be on, in this virtual world that we're living in now, just like a Zoom call, and we'll go over that until we need to.
Okay,
Yeah.
and then retirees can still stay on that
Yes.
policy?
That everything that we quoted and put forth, retirees are included on there. Based on when we did take the snapshot, we'll probably have to ask for information again just to see if anything's changed, firm up the numbers. But everything else should be in, as long as we didn't have any major changes from the last snapshot we got, everything should be good.
Okay.
I have a question about transition.
Yeah.
For the employees, I know that before I changed banks and thought, oh my gosh, I don't want to do all this, but they actually did everything for me, so it made it very easy. So can you talk to us a little bit about if we do this, the transition that the employees would go through?
Yeah, absolutely. So we really believe in communication. So we're going to be out there talking about exactly how the plan works. A big part of what I like to do is get pathways as the major focal point. Because if you think about it, beforehand, you change from Blue Cross to, let's say, United. There's a lot of work on your end because United's not really helping you. Or Blue Cross, you move from United to Blue Cross. Blue Cross isn't really helping you. What's beautiful about this program is now you have a concierge that will do everything for you. If you forgot what your deductible is, they're gonna remind you. If you forget what your network is, or what the best deal is, or you don't even remember a KISS card, right? They'll help you. And what's beautiful about Pathways, and I know this is really nerdy and probably more information than you want to know, but they also do the pre-certs. So right now you get a surgery. Let's say you get a knee procedure. You've got to call Blue Cross and they go through a pre-certification process to approve you or not approve you. And so with Pathways, they're the ones doing the pre-certification, but they also have your playbook. So they can reach out to that employee and say, hey, I know you're about to go to Octavia County for this knee procedure, but let me remind you that you have this thing called KISS card, and if you go down the road, maybe 15 miles or whatever it is, you'll get this procedure done for free. Your employees may take you up on that, or they may continue on the procedure the way they were doing it before. But that's never been something that you've had. So in our communication process, we're really going to emphasize that and talk about the value of it. And it's going to be a big part of what we do. But the rest of it, the deductibles, really not going to change a whole lot. There's not a lot of negative impact from a physician disruption standpoint. So there's a lot of wins because people have never heard of anything like KISS card before. Their minds are blown that this is even a thing. And we're going to give them the resources to where if they forget everything I say, it's still going to be okay because they've got a resource behind them they've never had before.
How about dental coverage?
Dental vision, we work with all the same major carriers. We of course attack the biggest and nastiest line item, right? Because it's the one everybody worries about. But there's not a dental or vision provider that I know of that we don't work with.
Okay.
So we can do that agent of record letter, or we can shop that around for you if you want as well. Yes?
Back to the prescription. If you're supposed to be on a medicine, but the insurance you have now will not approve it, how would y'all do on that?
So they have their own process, clinical team. Their clinical team is very sophisticated. Where we say from a clinical standpoint is not necessarily telling people that they're not on a drug. We'll have our own formulary like everybody else does. It's a very complete formulary. That's not where they're saving money, is the carved down the formulary. Instead, what they're doing is I'll give you an example. There's a big employer in Mississippi where they had an employee that had narcolepsy, and they were giving him a sleep aid. The narcolepsy sleep aid, I guess, was $140,000, but a sleep aid doesn't cure narcolepsy. And he was taking it once in the beginning of the night and once in the middle of the night, right? And so we gave him a pill he could take once in the morning, kept him up, and then he slept better at night, and it helped him with his narcolepsy. He was taking the wrong medication. That other medication cost $16,000. There are a lot of things like this all the time because doctors have these manufacturer reps that go in and they promise their drug is the most miracle drug, that it cures everything. And so our clinical team is really to just make sure you're on the right medication and help you there. But what we can also do is if you have a list of people that are changing medications, our PBM, Epiphany, will make outreach to those employees before the go live date and make sure that they understand what the drugs are and if there is any changes, why those changes are occurring. It could be they're paying $1,000 for a drug with the same compound, right, that you could get for $10, $15. And it's over the counter. A manufacturer's made it sound really special by putting a lot of commercials out there.
And keep in mind that this preferred PBM that we're recommending for y'all, they're the only PBM in the country that does clinical management. So another example of clinical management is, say your plan goes live 1/1, you hire a guy February the 10th, he's a bad diabetic, takes a lot of insulin. Well, it might be a whole calendar year before you see it now, it just comes up on the claim. Whereas right on this particular notice, they're going to attack that diabetic right away.
Yeah.
That clinical management, they're not going to let a lag of 9 or 10 months get back to renewal before you see it then. They're going to attack that diabetic right away.
Yeah.
I heard you all talk about maybe Baptist, but how does this work with specialized medicine? If you've got to go to Birmingham or Memphis to see specialists, Does this still work
Yes.
same way?
Yeah, and actually, we can go different ways with this approach. We have all the flexibility in the world. You go to Memphis Baptist, you're good. You go to Mississippi Baptist, wherever, you're good. If you went to another hospital there, we have the ability to negotiate with them too. Like I was talking to her, we have a partner, Zealous, that has a contract with every hospital in the country. Now, they're gonna take a percentage of whatever we say. But let's say someone went to Florida, or they went to Texas, or wherever they wanted to go, we would have a contract regardless of where you are.
Can you explain your relationship with Social Security, whether or not you're the primary or secondary provider?
On Medicare?
Yes.
Okay. So it just depends, from when you got on Medicare. You know, I think a lot of times Medicare is gonna be that primary, and we're gonna come in after it, but it does depend on when you signed up, what it looks like on your end. But there's going to be a coordination of benefits, okay? So what's gonna happen is the TPA is going to get with, what you have as far as your Medicare provider or any Medicare supplemental that you may have. And they're gonna coordinate benefits between the two, to where all you need to do is put both cards down, and they're gonna figure out everything from there. So you don't have to be a brain surgeon or know on your end which one's doing what. They're gonna figure that out and coordinate those benefits for you. And you know what's gonna be nicer about that? Right now, there probably is some homework on your side, but the Pathways concierge will help you with that coordination and understanding as well, because it can differ from person to person.
Right, so when we teach the team members to call Pathways on any healthcare issue, and you have an issue like up in Memphis or Detroit, wherever, hey, I work for Oktibbeha County, and they told me to call you in case I have anything. Great, let me walk you through what you should do. Here's here's one of your safe harbor hospitals. Here's where a hospital, here's your deductible, here's what your copay should be. I mean.
Yeah, but to your question, Pathways concierge, as long as you go to them, they'll help you with that coordination of benefits, and they'll take that burden off your plate. And I don't want to just make a big statement, because a lot of that does depend on when you got up for Medicare, how long you've been on your plan, all those different things, but they take it into account, and then they coordinate those benefits. It can also happen to people that may be on one health plan and this health plan at the same time. Maybe their spouse is on something and they're on both plans. There's a coordination of benefits there too. And they'll walk you through that, who picks up what.
And then I want the supervisors to understand, we will still be self-insured. We're not going to be fully insured. If we make this change, we will still be self-insured. So it's always gonna be about the amount of discounts that we can get from the provider as to how much it's gonna cost us.
That's correct.
So this model is based upon the model that we currently have.
That's correct. So it's self-funded. One of the things that's nice about it right now, I believe your stop loss has the ability to laser you at renewal, right? If you have large claimants, they can laser you. And do they have a cap on increase? I wouldn't
I
know.
don't know about that, but the difference, I would say, between taking a laser and not taking a laser, it's gonna adjust how much premiums we're gonna pay.
That's right. So in the captive, they cap you out. The most you can get on an increase, and this is just on the fixed cost on the captive side, is 30%. So they cap you out on the increase, but then they also say you have a no laser deal. So this part right here, the worst renewal you could get is 30% on this, okay? On that number right there. But on top of that, if I come through on a renewal and they say, John, Hunter, and Andrew are on our plan, and John's really sick. Well, you usually cap everyone out at $75,000, but John had $300,000 worth of claims. We're not covering John at $75,000 anymore. We want to cover John at $300,000. That's a laser. The beautiful thing, when you get in a captive, there are no lasers in perpetuity, and to your point, Emily, which is a great point, which is, but they can upcharge me as much as they want. They cap that out at 30%. So you're gonna get a cap where you don't have a cap right now, and you're gonna get a cap here where they can't bump this up.
I think that was a lot of discussion too, last time we talked about healthcare, is not having a cap.
Yeah.
You know, on it, when we talked about it 2 years ago, whenever it was.
So the only reason they can do that is because they have 1,000 employers in this pool, in this captive. And they all game together to get this buying power to where they can say, no laser at renewal, can't bump this up, and you can only bump this up so much.
If we switch to you though, and kind of what Miss Emily, I remember, what we have now, our current plan, will we lose that grandfather?
We will keep our grandfather status, cause we're still gonna be self-insured.
So here's the
So then we
only,
won't have to adhere to new and somewhat dangerous guidelines.
To cover things that can be costly.
So that won't affect us in.
No.
so the only way you can lose grandfather status is the benefits you offer today, if you offer worse benefits at renewal, okay? So if you gave somebody $1,000 deductible today, but at renewal you jacked it up to $3 to $4 grand, then you lose it. If you make the benefits, you change the benefits, but you make them better, you still don't lose that grandfather status.
We can't change our deductible, but we can change what we charge on premiums. We're kept out on.
You just don't change the coverage.
Yeah,
You
we're
can't
on the
shrink.
deductible, we
Don't
don't.
change it negative.
Yeah, we can't go up more on the deductible, but we can go up on the premium that we charge them for coverage.
Yeah, they'll allow you to
We're maxed out
grandfather.
at 1575 over on top.
Right,
This actually is to save the employee money.
yes.
And yes,
Yeah.
and the county money.
Yes,
Yeah.
if you think about it, when an employee goes in today with Blue Cross's discounts with B.O.S, if they're paying for 300% of Medicare, or whatever the number is, it looks close to that. Because if I'm looking at the discounts, and I'm looking at their gross charges are close to 900% of Medicare, I mean, you get a 50% discount on 800, 900% of Medicare, where are you, right? And that's what their gross charges look like. So now your deal's at 160% Medicare, so we're bringing it way down, and then we're impacting trend going forward with our direct deal. That's a heck of a deal. You guys, this is a really good deal.
Is, right now, the maximum the employees are gonna pay out is 1575. That's max, they're gonna pay out. It's got to be where it's gonna save the county money.
Right. The
Because
county will
we're picking
save,
up everything of theirs after the 1575.
the county will save money, but also if someone went in and let's say a procedure was $1,000 today, the gross charge was $2,000 and then cut it in half to $1,000. And now we're probably gonna cut it down to 70%, right? So instead of paying $1,000, they're gonna pay 600 and some change or whatever it is.
If they have not maxed out.
That's right.
1575.
So it can trickle down to the employees on what they spend. It goes to you guys as well on the overall charges. When it costs less just overall, everybody pays less for it.
And keep in mind, the two things that we always talk, cost containment, employee enhancement. If we walked in the car, there's building, you'd see that on our pillars. But the kids' card, the ability to have a $0 deductible and go to an outpatient facility, and then also having the cancer care network. We had one particular employee, no, don't need that cancer care, sure enough, they get into it, 3 of them within the first 6 months. It just happens. So they have all these other resources and tools. But I just had a baby last Wednesday and I had another one 19 months before that. So guess what? They know me at the OBGYN place in Memphis. So and my wife knows Pathways. Now my wife and his wife hear this constantly. And for my wife to tell me out of the blue, unanswered, Hunter, that's a really great program. Like they took me by the hand, they walked me through it. She was like, don't people just love that? I said, hey, we've had great success with it. And that's why I think people like y'all are educated and we get out there 5, 6, 7 weeks before the live date and we start communicating to these guys, hey, communicate Pathways, they're gonna put you on the right
So
track.
Pathways is a company that used to be called MedWatch. They were probably one of the largest pre-certification care management organizations in the country. The beautiful thing is HBI is a really big company. They're $9 billion. They just bought this company. So guess what we get, which is really special. Kim Klein is their COO. This lady here that you can see her picture. She is on all of our groups. So she is our direct contact. So not only do we get the best care management company, concierge in the country that does pretty much any direct contracting group. They're the ones that are going to continue to do their pre-certifications in care management and navigation. But we get their COO for any questions or issues that we have during the year on dial whenever we want, which is very nice, especially when this is going to be a big part of our communication and what we want people to go to when they have needs.
This particular video later on, and I know we're not going to show it, but they actually had, during the COVID, had someone have a doctor's appointment, called them that morning. They said, look, that doctor is actually shut down. Like, he's not taking any appointments.
Do y'all want me to show it? I want to be respectful of your time. I mean, I don't want to take up too much time.
But I was going to tell you that they're able to reschedule it for another doctor, same appointment, same procedure later that afternoon. So that's how impactful it can be and how quick the turnaround can be.
No, you're good. Okay. I'd be happy to send it to anybody after the meeting if you want to look at it, but it really is impactful. It's something that I've left enrollment meetings where folks have thanked me. They used to give me a hug before COVID and say I didn't understand the health. When I had Blue Cross before, I actually avoided healthcare because I didn't understand it. I didn't know what was going on. So I was really sick. I had things I needed to get taken care of. I didn't go do it. And with this process, it made it really easy on my life. And quite honestly, guys, that'll get you going to work every day with a smile on your face.
Will you explain, where we have, right now, Liberty Mutual, the 6312 as opposed to the 2412?
Yeah, so right now, you basically have run-in. There are claims that occur within the year that were processed during the year, but they're paid after the year, okay? And so you buy coverage for that. And so you bought run-in coverage for that. And for your specific, which are only your large claims, only the ones that are $75,000 and above, you have a 6312, which means it's basically probably going back to inception with you guys. I'm not really sure if that's how it did or it maxed out at 63. The fact is, it gets really cheap after 24 months, just because it's like an umbrella or something that you would buy. After a certain point, you have a $5 million umbrella. When you buy the next $5 million, the next $5 million are cheaper because the chances are your exposure is going to be within the first 3 to 4 years where a claim was processed but not paid. So this is a 2412. It's going to protect on those run-out claims for the entire 24 months of the prior year for any of those large claimants. You are already at 2412 on your aggregate, and we are matching that. But from the specific contract, it's going to be a 2412 compared to a 63. So you could go back 4 to 5 years for claims that hadn't been processed but not paid, but at some point it's kind of ridiculous because even if you look at the contract, Blue Cross makes sure that these folks have to get claims to them within a timely basis. And once that time runs out, it could be a year and a half or a year and 6 months or a year and 8 months or whatever it is, you don't have to pay that claim. You're not contractually obligated to pay that claim to that hospital anymore because they didn't file it in a timely basis. So at some point, you can continue to buy this coverage, but I don't recommend it. And if you want it to be a 63, I probably could go back to a 63.
Okay, and so basically what that's saying that a claim 63 months ago could appear this year and it would be paid.
It would have to have been processed 63 months ago and just paid today. And like I said, the one thing about that is if that hospital, most of the time when that happens, it probably wasn't processed. The services occurred and it didn't get processed. Because if it was processed, it's going to get paid within 90 to 120 days.
Okay, and so Ontario County would still have to pay it, but that would not go against our reinsurance, that the reinsurance would deny it. Am I understanding that correctly?
If it was above the $75,000 threshold, right?
The reinsurance would deny it based on the age of it.
Which is, you do a 2412 on your aggregate today anyway, right? So it's the same thing from your aggregate to your specific. If you had a claim that occurred, 63 weeks or whatever it is, and it was over $75,000, and the hospital probably didn't process it, the one thing I would say, I would fight that thing with the hospital and say, this is not timely filing based on your Blue Cross Blue Shield ASA. And you need to read your contracts with them and notice that you need to get this within a 2-year period or less. But I'd be happy to help you with that process. Thank you, guys.
So our final, John, told the total proposal savings?
Yeah, so, if you look here, this has got everything with fixed costs. If you wanna look from a claim standpoint, because we're saving a little on claims, but on a claim standpoint, we're saving $185,000. If you get fixed costs in there, because we're paying less for reinsurance, it's probably, close to $200,000.
What type of cost are we gonna be paying on drugs?
Less, so $56,000 less, and are you talking about from the employee perspective?
I'm talking about from the county perspective, because whether the employee pays it or not, it's still gonna be the county's cost.
$56,000 less.
Okay, cause y'all are gonna have better contracts with drugstores or what?
Well, it's more complicated than that. The spread pricing is pretty close between the two. If you look at it, there's really 4 areas of savings. So what you're talking about is spread pricing. That's just the AWP, average wholesale price. There's about 5% savings there. So there is some savings. Some of that is maybe the discounts. Maybe Prime is a little bit better, but they are selling you something for $1 that's really 75 cents.
Yeah.
So that's their savings there. The rebates, of course you get your rebates. You have to take that off of this number because I don't have that number. But the copay assistance, which is manufacturers today, they're giving people a little card to buy their Humira. Humira is really $1,000 a pop. They're making it feel like for that employee it's $0 to $5 when they get a little card from the manufacturer. That money your employees are still going to get. They're still going to get that drug for free. We're just going to capture that money from the manufacturer that y'all aren't capturing right now, and that's an additional 8.96. That's probably
the county's gonna get it.
Yeah, the county's going to get. It's going to go directly to the county. The employee's going to pay the same amount they paid for their medications, $0 to $5. We're just going to take that manufacturer that's been manipulating drug prices in the process, and we're going to capture money from them. And then there's another 3.6 in clinical, which is people that are on the wrong drugs, things like that. So that's what that breakdown looks like from a drug standpoint. You really don't have to affect what the employee's paying to get these 3 line items. We just are being more efficient in the way that we're processing payments and collecting money when we haven't collected it.
Yeah, in that contract.
I've noticed this year with our retirees that's over 65, that we are paying out way more than what we have been in the past to that same age bracket, and it's based on the drugs.
That's right. Most folks, we're seeing an increase, standard trend on drugs, anywhere from 8 to 9%. The PPM we use is closer to 3% if you're not using all the different areas of collecting different income. If we put all these areas together, it gets even lower, closer to 2 to 1%. So just think about that swing, going from a 1 to 2% trend all the way to an 8 to 9% trend. That's a huge swing. And think about the facilities, going from an average 6% trend to an average 1.6% trend. So the money really, guys, the money's great this year. I'm happy that we're winning, but the money is long term in this. And getting stuck on something where they're going to increase the cost of everything over time, and you're going to keep getting hit with 6 to 7% trend, and we're down here. Even if we didn't have a direct contract, they're running at a 3% trend, and we're running closer to 1.6. That's where your big money is. It's when the alligator mouth gets its teeth, is at the very end.
How do y'all handle COBRA and release?
So COBRA can be handled by our TPA, and I believe I have that built into the fees. I'll have a breakdown of fees for you, just so you'll see where each line item is. But they can do that, and I think that's the most effective way to do it.
Yeah.
Just because they get the information before everybody else.
So, prescription savings and other savings will total up to,
Yeah, so those differences right there doesn't look as big when you're on that graph, seeing how much money you can save over time, but your spend will go from 1.646 to 1.445 with a better contract, better discounts, better TPA, concierge service, all of those things, those line items are all added in.
Anything else?
That's it, thank you so much.
Thank you.
I really appreciate it.
Thank you all, I appreciate it.
Thank y'all. A lot of food for thought, but we'll certainly take a good hard look at it.
I appreciate it. Thank you again for having us in today.
Moving right along, road manager's report, Mr. Baggett.
I was getting out there, I just had another text message that the live feed's not working.
Yeah, I'm sorry about that, guys. I'm gonna have to get in here and do something about the stability of the internet in the top of this building. We're having issues with getting our connection to live stream out from here.
I got the Wi-Fi password for that other one.
It's probably not for this moment.
Okay.
Hey, this is yours, Kristen. I stole this from you this morning. When I took my stuff back.
I lost my desk.
Yeah, so I'm sorry, I saw it had some sticky notes on it.
Okay, good morning, board.
Morning.
Thank everyone. Should have a copy of the road manager's report.
Took a look at it. Anybody got any questions for the road manager on the report?
Mr. Baggett, there's still some debris on that road in Sturgis where we fixed that cross drain, you know, that I mentioned before. Can you follow up on them picking up that stuff on the side of the road, please?
I will. You talking about right up?
Yeah, the one where they had to go in and cut the driveway and, put the drain across and
Right.
all that stuff right there. But it's still, I was down there, you know, last week, it's still piled up in the side of the road, so.
Okay. I will add, we dug that driveway out on Saturday, board today, and we clean up when we, leave.
Thank you.
And I'll get through with this clean.
Let's see, touch.
And if not, then we need to, accept the road manager report. I need a motion and a second to do so. Motion by Supervisor Trainer, second by Supervisor Miller. Any other questions for the road manager? If not, all those in favor say aye. Aye. Motion carries.
I would like to mention that I have gotten Mr. Baggett to replace some fences on Longview Road
Yes.
that we were having trouble getting moved into no longer hold up the project. I had asked Mr. Baggett to replace them to keep him out of trouble. I'm just gonna take the middle line on, tell him no, that we needed to do it, so.
Ms. Emily, thank you for doing all that following up. I don't know if y'all knew last week that she was the one that actually had to track down all that information. I feel like that should be coming from our, engineer every week to let us know. I'm a little disappointed that that project has not gotten moved further along Longview Road. I think we all are. But I wanna thank Ms. Emily for actually tracking down all that information.
Yeah, she did, and the numbers were not current, you know, the phone numbers, so it was a bit of it's tough to get it.
So I said, you've got that done already.
I have, it was like 1,200, it's quite a bit of fence.
I just told him that he's scared he's gonna be in trouble. I said, no, it's gonna be me, so go ahead and keep.
If it's okay, I'd like to, add in a covet for Larry Anthony on Octot Road. And that's at the intersection of Mount Olive and Octot.
Got a motion by Supervisor Williams. I'll second by Supervisor Trainer. Any more discussion? If not, all those in favor say aye. Aye. And, back to the Longview Road, which we were discussing, Mr. Baggett, on the fence issue is, how long do you think it'll be? And I'm just asking, before we can get those 3 sections moved back. You gonna try to do it this week?
I'm gonna try to do it this week. We've got the material and everything, and we're trying to do it this week. Okay, on, Johnny B. Lane,
On where?
Johnny B. Lane, it's a really small road, right off of 182. And it's really small, 2 cars can't pass. And the garbage truck does not have a place to turn around, there's not a way to turn around. And so, we needed to fix, some type of turnaround, backup turnaround, and turnaround for the garbage truck on the end of that road. And I'm requesting that you give the road department, go ahead to do that.
Is it a 911 road?
No,
It's a county road.
it's a county road,
All the way.
all the way.
And I didn't get that last word, Johnny who Lane?
Johnny B.
Johnny B, okay.
Motion for approval.
Second.
Motion by Supervisor Williams, second by Supervisor Trainer. Any more discussion on the matter? If not, all those in favor say aye.
Aye.
Okay, we were cutting a lot of driveways out, and we've had a challenge with, getting these put back in. And we were just able last week to develop a crew that could do that, and that does it well. And, we had a situation over in Valley View where the owners decided to go ahead and put their driveway back. And what they requested from us was a load of pressure run for the subbase. And, it was a considerable savings. To put the driveway back, it was like $1,200 to give them 12 tons of pressure on it was $268. And so, and then we would have to go down anyway, so we gave them the pressure.
You need a motion, just spread that on the minute.
Yes.
I move we.
Motion by Supervisor Howard. I'll second that. Any more discussion on the matter?
And where was the address?
Valley View.
Valley View, yes.
All those in favor say aye. Aye. Motion carried.
I think that's all I have.
Mr. Baggett, on Lanier Lane,
Yes.
have we figured out what it is a county road, so before I go down this road, it is a county road. Have we figured out what the issues, and I'll put quotes around issues, I'm aware of some of them, but have we kind of figured out what we might need to do to approach that? I talked with one of the, constituents that live on that road, last week, and there apparently is a discussion as to who owns that road. Is there any need for us to get easements or something to that effect? What would be your take on that? And I bring it up because I may need permission to do more.
Yeah, we need easements on it, and I ran into this in other counties. A lot of times they build roads, I don't know how, and there weren't any type of easements or anything on record. It's just a road, and this is one of those situations.
Okay. Could I get permission from the board to look into getting easements? Let's just use.
How many houses are on that road?
Apparently about 4 or 5. I'm not positive exactly how many. I spoke with one of our constituents, and this is in Supervisor Williams' district, and he's running into problems with an individual on this road who apparently, I think they own the road. Well, this is a county road. It is on our county road map. And I don't want to do anything outside the purview of what this board wants me to do, but there's an issue that you have people on that road that are not getting the services that that the county should be providing for that particular road. But the other side of the coin is you don't have easements. on some of it.
That you met with?
Yeah, I met with, just about everybody on the road. I don't see, I'm trying to figure out the necessity of getting the easement. If the road was officially adopted, just like all the other roads in Ottawa County in 2000, we legally, officially adopted all of the county roads in Ottawa County. So that road is just like any other road in Ottawa County because it was legally adopted as a county road. So I don't see a necessity of getting easement. Now what is the situation? The situation is that the person wants to look into the possibility of transferring it back from a county road to a private road, and I don't see necessity behind that. So the question is, how do you go about doing that? Do you need 95% of the people to sign a petition to change it back from county to, how do they legally make it a private road again?
Abandoned.
The board has abandoned.
Yeah, but it gotta be a process.
The three votes?
Gotta be a process. No,
You have to.
no.
We have to
The
advertise.
people's on it, not just one person on the road needs to
Don't you have to
request
advertise,
it.
make sure someone doesn't object to that?
Yes, and I
Yeah,
think it
you
has.
can't
to
have
be-
one person coming in and say, I want this to be a private road.
Well, if they own the
can't-
whole, like Rogers Road, they abandoned that years ago at this gate. It was a county road, went all the way to Bluefield. They abandoned that, I think like Supervisor Trainer saying, 3 votes. Says, hey, we as a county, we're abandoning this road at this point, change the road registry from so many feet to this many feet. Be at 0
It's not that
feet.
simple, it's not that simple.
I,
It's not that simple. Besides, you have to have a public hearing, first of all, and you have to advertise it in the paper. Then you sit here and say, okay, this is a private road now, because there's more than one person on there. It's several people's on there, just because one person said private, and all the other
This
people
one's a little
said-
different, cause it was, they owned all of it. You know
Well,
what I mean?
yeah, the question is, what is the process? What is the process? And that's a legal question for, I believe, for you, is what's the process?
in a certain case, we run into a situation where somebody that's wanting to abandon the road does not live at the dead end of the road. They might be living at the beginning of the road or in the middle of the road, the length of the road, and they're wanting to abandon, not be a county road, which we might give other people access to get home.
It would have to be consensus from everybody, I would think.
It would have to be a
If you live
consensus.
down the road behind me,
It's- That's
That's
right.
what we're getting at.
You only have basically one person who is pushing to make it a private road. Well, you got everybody else on the road
then they're not
who
gonna,
might not feel that
it has to
way.
be a
So
unanimous consensus.
it gotta be a unanimous consensus, at least it has to be a 95%,
I would think.
or 85%, or 75% of the people that said they want it to be. But I don't know the process.
Yeah, I
Well,
got it.
I want to know the process because they're asking me, what is the process of changing it from a county to a private road?
Is the person I think I know who the person is that's asking this, but that particular person lives at the front of this road.
That's right,
And-
and everybody else behind.
And I do not think that, and I am not advocating that we abandon this road, so let me be very clear. The people that I spoke with were not in favor of abandoning
They
the road.
don't want this, so we
They're
will
just
sit here and vote on that.
Well, in a case like that, that's not even something to consider.
No, I mean.
The board makes a decision, but I wouldn't be in favor of abandoning the road on those conditions.
I have affidavits signed by all the active supervisors in July 2006, when the road register was adopted, that those roads that we adopted as county roads were being maintained by the county for 5 years or more. And this road that he's talking about was one that was, being maintained and was adopted as a county road, with the supervisor giving an affidavit of it.
I read that document, I saw that document. That's right. So now the question is, what is the process? If a person someone come to you and say, I want this to be a private road, what do we do?
This particular person.
We just ignore, do we ignore everybody else on the road and just award her request?
No, sir. That, if she wants that road to be abandoned, she's gonna have to get all of her neighbors to agree with her. That's not gonna happen, but
That's
she's
not
gonna
gonna
have to get all of them to agree with her. For that matter, I won't say what's occurring here, but if there is an obstruction put in that road to suggest that they have no right to use it, then that obstruction can be removed and she can be fined.
Yeah.
Or that person, let me rephrase this, that person can be fined.
So do
We're
I,
obstructing the county road.
Correct.
do we ask that particular person to get a signed petition from the individuals on the road and present it to us?
That would be a good start for us to know that there is some movement actually wanting that road to be abandoned. I think that would be a perfect
That would be a
step for her to do something, if she wants to be productive in getting that abandoned. But
Right.
that is not my position with this road at this point from what I've heard from your constituents.
To ensure that we are legally correct, would we draw up the petition to that? Or would she type up a petition? Well, I know some individuals leave information off and they're not wording it correctly.
She would she would have to, I would say that she would legally need to do the legal work to get it to us for the request. And then if the board of supervisors took that under advisement to follow through on it, then we would verify that those signatures were legitimate. And then we would be required to publish, the big old long things that has to be published in the paper for the process of abandoning the road with a hearing. When it's anybody, other people living on the road, so I would
Give
imagine.
everybody a hearing to come, it's a dispute or
Yes.
agree, whatever.
If the board decides that they wanted to follow through with that. The last road that I remember us abandoning, I think was Acres Road out in Valleyfield.
Well, let me ask this. Apparently the county decided that it was in the best interest of the county and its citizens to adopt this road and maintain it.
That's right.
So, there's only maybe one reason I would see that the county would consider abandoning the road, and that is that there is no longer anybody else living on this road, and it doesn't benefit the county to continue to maintain it. And even with that being said, the county may have made a determination that maintaining this road is for the best interest of the county to not create problems, other problems. You know what I'm saying? So, I'm sort of wondering here,
Yeah.
I think it boils down to what the county decides.
For the health benefit.
Whether they will or not want to abandon this road.
And safety.
That's exactly right.
Yeah, I mean, that's,
You're right.
I
That's
think
what I would think.
in his case, he's trying to, go through the process that makes the individual not think that he's just brushed her off.
Well, it gives her an opportunity,
Well, give her an opportunity.
if everybody feels that way,
Yeah.
then we'll move
Yeah.
forward.
If everyone feel like the
That lives
road
on
need to be
that road.
abandoned, then that's good, we abandon it.
But to be clear, the county could still state for the public health and welfare of its citizenry that road would stay open.
right.
And frankly, that we'd have to have a whole hearing process and the whole 9 yards, but my legal opinion and my honest opinion for the benefit of your constituents out there, one person doesn't make this decision, and right now, I think that one person thinks that they can.
And it would not be just the people that own the road, that live on it, it would have to be property owners too, that have property along that road.
I can't see it, what doing.
But that gives them their avenue. comes out. Anything else? We go ahead. We
Let
appreciate
me
you.
ask while we've got Mr. Baggett here, have we allocated our state aid monies? And one thing, Mr. Pritchard, last time I met with him, he was saying that he sort of wanted to meet with our road manager to determine if there's any part of this that the county can do. Where are we at with allocating our money and putting together
I think, let's see, Brickley's allocated hers, maybe John's worked with
I've
Mr.
asked Clyde,
Clyde on it, but you
I
need
would,
to get with him, cause, you know, we got that situation cleared up where we got our money back from, that we had allocated to blackjacks. I think right now y'all all have like $422,000 each of it, so if you haven't already got with him, you need to.
I got with him, but it was that little caveat in there that he was wanting to sort of meet with our road manager.
Well, then the road manager probably needs to get with him if he's holding it up.
Mr. Baggett, can you give, Mr. Pritchard a call and just kind of see
I can.
if there's something he needs from you?
Okay, I'll do that.
Thanks.
And one thing that I've noticed this time, we're getting those advanced credits along, and so each time I give y'all a statement, you get a little more money to put it on.
Okay.
Thank you, Ms. Baggett. Moving right along, jury qualifying and selection, Captain Watson.
Yes. What we're asking the board to do is to designate the safe room as an alternate site for court operations, particularly this time, with COVID-19 situation still going on, when we have to bring in jury pools to either qualify for a grand jury, qualify for petty juries. You're talking about quite a few people, into one space. Our current courtrooms in neither courthouse will accommodate that many people, in one courtroom with social distancing. We tried it last court term by splitting them amongst two courtrooms, and functionally it did not work well. Most of the counties around us have gone to alternative sites where you can get them all at least in one place. There's plenty of room in that safe room. We can still set up for security, to keep everything like it should go in there. So we're just asking the board to designate that as an alternate site. I think we need your permission, and two, I think legally we have to get y'all's
Get a board on.
designation to do that.
Motion for approval?
Got a motion by Supervisor Williams, second by Supervisor Howard to designate that safe room as a secondary site for our jurors. And is any more discussion on the matter?
Alternate site for court or jury selection.
I would just say court operations. I don't foresee it right now, but there may come a time when we might actually need to have a trial there.
Okay.
This kind of fits in with my ongoing continuity of operations plan in case one of these courthouses has to be shut down for some reason. That gives us an immediate alternative site we could move to and continue on without having to delay court any further.
So the board order needs to be for court operation, not for just
I think
jurisdiction.
Not
court
just,
operations will be.
so anything relating to the court operations. All right, got a motion and a second. Any more discussion? If not, all those in favor say aye. Aye. Motion carries unanimous.
Thank you.
All right, thank you, Brett. Moving right along, Ms. Livingston.
The only thing I have is we didn't have a CD for the month of September, and the funds remain the same at Citizens Bank.
All right, thank you so much. Do we need to acknowledge
I
that?
need to acknowledge that.
All right, need to acknowledge no CD purchase, for back in September. Second, or motion by Supervisor Williams,
To acknowledge, no CD for.
second by, Supervisor Howard. All those in favor say aye. Aye. Motion carries.
That's all I have.
County Business Administration, Ms. Emily. Need a motion and a second to approve payroll changes. Motion by Supervisor Trainer, second by Supervisor Williams. Any more discussion on the matter? If not, all those in favor say aye. Aye. Motion carries unanimous.
Ms. Livingston had received a letter from Michael Watson, Secretary of State, about a member road memo of understanding between their office for some of the COVID money that we were gonna be allocated through them, that I need, the president and the chancery clerk to sign, so we get that processed.
And we need,
Motion on
all right, motion by Supervisor, Miller, second by Supervisor Howard. Any more discussion on the matter? If not, all those in favor say aye. Aye. Motion carries.
Time for
We need these in a second.
the chancery clerk's office to, get a new Pitney Bowes postage meter, and so I need the board to agree, allow her to get a new meter at the cost of $60.57 a month. They're getting to be a little cheaper.
All right, need a motion in a second to get that request made. Motion by Supervisor Howard, second by Supervisor Williams. Any more discussion on the matter? If not, all those in favor say aye.
Aye.
Motion carries unanimous.
Next thing I have is, renewal of our high availability computer lease agreement with Three Rivers. It's, we've been through the first cycle of it, kind of start the second cycle.
There and there.
Next time that, yeah, you got some.
Sherry does
You
motion by Supervisor Williams. Second by Supervisor Trainer. Any more discussion on that matter? If not, all those in favor say aye.
Aye.
Motion carries.
I have, individuals call me wanting the removal of 2911 road names of Odie Lane and French Lane. And I think both of these are located back behind the C shop. He's, converting that from a little mobile home park to something else, and those roads are no longer gonna be there.
So, motion by Supervisor Trainer. Second by Supervisor Howard. Any more discussion on the matter? If not, all those in favor say aye. Aye. Motion carries. He's going to change all that up. New clerk.
Do with those. It's time to renew the annual common health care case management contract with Governor Trumbull Planning and Development District. Is the order for that?
There's a motion and a second for that.
So moved.
Motion by Supervisor Howard, second by Supervisor Williams. Any more discussion? If not, all those in favor say aye.
Aye.
Motion carries unanimous.
The, start what we know, County Consolidated School District has requested a bus turnaround at 4015 Skinner Road. We get an order for that.
Need a motion and a second. Motion by Supervisor Williams, second by Supervisor Trainer to ask for the bus turnaround. All those in favor say aye.
Aye.
Motion carries unanimous.
Credit card charge in the amount of $89.56.
Need a motion and a second. Motion by Supervisor Williams, second by Supervisor Trainer, pay the credit card. $89.56. All those in favor say aye. Aye.
Payment of claims docket.
Motion by Supervisor Howard, second by Supervisor Williams, to pay the claims. Any more discussion on the matter? All those in favor say aye.
Aye.
Any opposed? We have 4 abstains.
And, I didn't get it on the agenda, but it was in your packet. I need an order to, accept the deletions and additions and deletions off of the September 20th, 2020 inventory, along with accepting the final inventory report.
Need a motion and a second for that. So, motion by Supervisor Trainer, second by Supervisor Williams. Any more discussion on the matter? If not, all those in favor say aye. Motion carries unanimous. All right, thank you, Ms. Emily. Let's see here, county business supervisors, talking about the curfew.
Motion we extend the curfew.
Yeah, I think we should extend the curfew. It's working for, the sheriff's department, in my opinion, from 12 to 4.
Mr. Montgomery, if you'd like to hear some numbers, I have some for you.
Sure, go ahead.
Just for comparative purposes, in August, when this curfew was not in effect, the sheriff's department had 1,086 calls for service. In September, that number dropped to 816, almost 270 less. Over the course of this past ballgame weekend, 3-day period, we answered 74 calls for service, which is down considerably from other weekends, even though it was a ballgame weekend. And a big telling number for us, in August, we had 26 auto burning reports that we took, most of which occurred in the early morning hours. In September, we had 7. So that's a considerable change for us, from when the curfew was not in place.
Yeah, comment. That makes it
So
better.
that's what I was asking, is if we had information from the sheriff's department, they were still requesting it.
Yeah, and that's the thing is that we're keeping a lot of trouble out of Oktibbeha County by doing this. And the proof's in the pudding, and Captain just explained that to us. We've got a motion by Supervisor Trainer. I need a second. Second by Supervisor Williams. You're closer to me on both ends. Any more discussion on the matter? And we'll extend this to our next board meeting, which will be the 19th of October. Is that okay with everyone?
That's good. That's good.
Yeah. All those in favor say aye. Aye. Motion carries.
Mr. President, I also would like to recommend that we extend the mask mandate also.
Well,
I'm an overall.
yeah, and I respect that. He's got a motion to extend the mask mandate by Supervisor Trainer. I'm kind of like this. The governor expired at the 1st of October, to my knowledge. And so, you know, if it's not a united front, you're going to have some that are out, some that are in. And at a certain point, you have to let people make a choice, you know, and as far as their safety is concerned, you know, social distance and things like that. But if, you know, quite honestly, if there's going to be some counties, entities that are going to do this and some that are not, it's almost to a point where it's somewhat futile. You know, if everyone's going to do it, I'm for it. If everyone's not going to do it, then we should all be not doing it. But you know, there's going to be counties I know around us that are not going to take this on, and so I mean, to that point, you know, it's not gonna prevent it if we don't all keep this in place. So,
Did the city extend that? Yeah, the city.
well, theirs is coming up tomorrow night. Theirs is coming up tomorrow, so I don't know what the city's gonna do.
It was a comment made about the city extending their mask requirement.
And they may, but their scheduled board meeting that I know of is tomorrow night. So,
I do know it sort of causes some confusion if you don't do the same thing. I know I get phone calls about curfew and things like that. So.
well, I mean, it's whatever this board, it's whatever the board wants to do.
On this particular issue, they've been allowed to do. On this particular issue, for COVID purposes, every city has been allowed to
So the
do
state
it.
law doesn't override the city law?
Not, well, generically, yes. The problem that we got is, I know that, I'll use a city up north of here that we're not supposed to say.
Right.
That they have a mask mandate, and my understanding is they're gonna keep it. So, my legal advice is if y'all want to extend it, you can. If you do not want to extend it and you want to be applicable with state law, you can do that as well. So,
I'm gonna second.
We got a motion to extend the mask mandate, second by Supervisor Howard. Any more discussion on the matter? If not, all those in favor say aye. Aye. Any opposes, say nay.
No.
So, motion carries 3-2.
Is that through when, the next board meeting or beyond?
Yeah, well, you okay with the next board
Next
meeting?
board meeting.
Let's do till the next board meeting because, you know, we handle it as we come to our meetings. All right, so motion carries, and that was Trainer, Howard. Okay. All right. Golden Triangle,
We're gonna be in serious trouble. We don't want
solid, Solid Waste Authority Board appointment.
I'd like to make an appointment to that, make a suggestion rather, to appoint Mr. Curtis Snell to serve in the position that was occupied by Supervisor Margaret Howard. It was brought to our attention that we need to make some adjustments in that selection. So we recommend Mr. Snell to replace Mr. Howard on the board.
Got a motion to put Mr. Curtis Snell on the Golden Triangle Solid Waste Board.
Let me say, it's not because I wasn't doing a good job. The statute said I had to get off.
Okay.
We want to accept,
Oh, yeah, let me, my
Mr.
resignation.
Design,
Yeah, okay.
Do we need to accept that before we put him on there?
yes.
So, let's table that matter.
Well, I motion that we accept Supervisor Howard's resignation.
All right, motion by Supervisor Trainer, second by Supervisor Williams, to accept the resignation from that board. And, Ma'am Marvell, we appreciate everything you did on that. You fought the good fight, kept us informed. And, man, he's got big shoes to fill, but help him where you can, and I think he'll be fine.
And for
So-
argument's sake, it was upon legal advice that from the board attorney to me, that he should get off that, so I don't want to suggest in any way, shape, or form that he was kicked off. This was after I looked at the statute and he asked for advice on that, so.
Fair enough. All right.
And just to be clear for the public, this is the regional
Landfill.
landfill board.
Not the Golden
Right,
Triangle.
not the Golden Triangle.
Okay, so this is the Regional Solid Waste Authority Board. Okay.
Right.
All right, so we've got the motion and a second to accept your resignation. All those in favor say aye. Any opposed? So 5-0. Going back to that, we got a motion now that we had tabled. We'll say was Supervisor Trainer had made the motion, Supervisor Howard had seconded that motion. Put Mr. Curtis Snell on that same board. Any discussion on that? If not, all those in favor say aye. Aye. Motion carries unanimous. All right, we also have a library board appointment.
Mr. President, I'd like to make a motion that we appoint Ms. Jessie Collier to
I
serve
saw
on the
that.
library board appointment.
Got a motion by Supervisor Trainer to put Jesse Collier on the board, second by Supervisor Williams. Any more discussion on the matter? If not, all those in favor say aye. Aye. So Jesse Collier is on the library board. I do have one thing, I'm asking about the garbage can status. Are our cans for this year, are they in?
Yeah, they will,
Today?
they are ready for pickup now.
So we can get them
Yeah.
now. I've got people that are,
October first, became the date that can be released.
okay. Do we need to task again our road department to go out there and get some more? Or will they
It's
let-
already,
It's up
yeah,
to
already
you.
got us on.
Well, they're gone. The 100 you mean? They're gone. They got more up there? Cause I asked Friday and they didn't have any.
Okay, well, you know, that's if the
Somebody
board
got more than
wants
they
the
should.
road department to go and pick them up.
I mean, I'm fine. I just, either
Yeah,
way.
Yeah, they usually drop them off at the satellite shops. I sort of like to go get mine because it sort of cluttered up my satellite shop out there.
Yeah. Well, I mean, I know they had picked them up and they took some to Central too.
Yeah.
They said
That's
they're
fine.
totally out.
Yeah, that's fine.
Can we do that? Can we, in a form of a board order, have a motion in a second to ask them to go get some more cans and bring them to the Central shop? I'll make that motion that we get our road department to go get some cans and bring them to the Central shop. So that's my motion. Second by Supervisor Trainer. Any more discussion on that?
I got a place in Supervisor Trainer's district that I've been dealing with, waiting on more trash cans, it's only gonna take 75.
How many?
75.
Oh.
So is that some apartments or something?
The mobile home park that we're making go from another thing to our thing
Individuals.
and so, probably gonna have to have 75 cans when I call them.
Make it happen, we'll make it happen. I did it with the other guy,
Yeah.
we went for 20. So that's why y'all get text messages from me about those cans, and you know, I got people that's breathing, that want them, and they sitting, and so, that's why I try.
We might have to look at some special purpose.
Yeah.
I mean, purchase.
At a certain amount of-
Because if we snatch that many cans at one time for one district, that's gonna put a sort of a hardship across the county, so we might have to make a special purchase from Occidental County to purchase, another 100. That's not covered by the contract.
That's a good answer.
Supervisor Howard, you might be able to help me out with this, but that 100 cans that we received was a carryover. So we haven't gotten a new shipment of cans yet.
We're at 0 for this year.
Right,
We're
we're zero.
zero now, we don't have any, but we are expecting some by the middle or the latter part of October.
No, we
They got
should
them
have
now.
cans in over there now. That the release date for those cans was October 1st, that's when the new year started.
Okay.
Those was the 100 cans.
They
100.
gave us those.
Yeah, that's carryover, that's not the new order.
Right.
That's
No,
not a new order.
that was, unless the new shipment is not in, and which I think the new shipment is in, they were to be released October 1st, that's when the new
calendar
That
year.
450 supposed to come.
Right. But we increased the total amount
Five.
for annual by 100.
It's 500 or 550, I can't remember.
Yeah, whatever the original number was, it increased by 100.
It was 450,
Okay, so it's 550 now for the annual amount.
and then I ain't 75 of those.
But I do have a motion and a second for us to ask the road department to bring some to the central shop. So all those in favor say aye. Motion carries on that.
Who was our second on that motion?
It was I motioned and, Trainer seconded. So those cans, it's good news that will be in. Do we need to cover anything, what you may have given us?
I've been talking to some supervisors, we're gonna go into executive session and the next week talk about it.
Can we
Personnel.
go through the county stuff a little bit first?
Sure.
Yeah. I just wanted to update that, there's the location for the storage for the light for Old 25 and Poorhouse Road. Randy Massey has agreed to store the poles right there, which is really close. I had offered the end of our area, but, just to make it less complicated, Randy has offered to do that, and so at no charge to the county. So hopefully the poles will be in pretty quickly and we can get that light put up on the corner of, Old 25 and Poorhouse Road, which y'all know there was another wreck there not too long ago. So,
T-bone.
I also wanna ask about the, interlocal agreement to get Pleasant, Ridge Road Bridge fixed. You know, that's in the city and have already discussed that, but we need to get that. And also Skinner Creek, so we can go ahead, the city had volunteered to clean that out for the county. So if we could go ahead too and get those interlocal agreements done. Rob, do you have a time frame on that?
I'm supposed to get with, their attorney, and I actually met with the mayor last week, and she was asking the same thing, and she said for us to get together. It is the intent, I thought we had already voted for this to move forward, and I guess that was the waiting period, was that interlocal agreement. So I will get with him this week and go ahead and pull the trigger on that, and before we do much more, get with Ms. Emily, make sure it's how we need for it to be prepared.
That's all I have.
I just, checked Mary Ann on the garbage can, and she said she's hoping that they they will arrive this week or next week, that things have been delayed due to COVID. But, she's hoping for them for the arrival this week or next week.
Okay.
So we
So,
have our next meeting, you think?
all right, let's do that. Let's do supervisor business. So anything else from District 3? Supervisor, Supervisor Williams.
I don't have anything.
Supervisor Trainer. All right. I don't have anything from the chair. So I guess we need to go into executive session for a personnel issue.
Go into closed session to determine.
Closed session, excuse me.
Executive session.
A motion by Supervisor Howard, second by Supervisor Miller. All those in favor say aye. Aye. And we'll go into closed session.